Hi guys, my name is Jeannie Montgomery and I'm here at Ashford and Sterling Internal Medicine and Pediatrics. I'm going to discuss IUDs with you all today. Intrauterine devices, IUDs, are the birth control option that most women use worldwide for birth control, and for good reason. IUDs are 99% effective at preventing a pregnancy. This is more effective than a woman having a tubal ligation, tubes tied, or a man having a vasectomy. Unlike tubals and vasectomies, the IUD method is easily reversed. It just takes a short office visit to remove the device and then return to fertility immediate. So it is unclear why IUD use is much less frequent in the United States compared to the other parts of the world. Looking at all the countries, 21% of women choose to use an IUD, but only 8% of women in the United States choose an IUD for contraception. Researchers and manufacturers of IUDs have taken a stab at determining why fewer U.S. women choose the IUD. It seems that women are concerned about issues having to do with the cost and the safety. Safety. IUDs of today are not your mother's IUD. They are designed differently and do not promote uterine infections. Although infection is still a risk, the risk of an infection when using an IUD is the same risk facing any woman who has intercourse. The risk is neither higher nor lower. After the first 20 days following insertion, most infections that occur are due to naturally occurring vaginal organisms being introduced to the uterus during insertion. Even so, the rate of infection following insertion is less than 1%. Still, the woman's partner should use a condom to reduce the risk of infection during the first 20 days after insertion. The main risk of getting a pelvic or uterine infection for women is not being in a monogamous relationship no matter what type of birth control is used. Each partner introduces new bacteria and increases the chances of infection. The risk is decreased when the relationship is monogamous. If a woman is not monogamous, or if she is not sure her partner is monogamous, it is wise to use the barrier method, condoms, in addition to the IUD to prevent the introduction of infectious organisms to the uterus. Loss of fertility is another issue, and this is very much tied into whether or not there has been a uterine infection. When there has not been a uterine infection, the pregnancy rate after removal of an IUD is the same as for women who use other forms of contraception. There may be other reasons that a woman has difficulty getting pregnant. The most common one is delaying attempts at pregnancy until after the age of 37, at which age there is natural decline in fertility. How do we know that there are not more pregnancies with an IUD, and the IUD does not just cause an early miscarriage? From good studies that looked at the levels of the pregnancy hormone, HCG, in women using IUDs versus women trying to become pregnant, this hormone increases very quickly once an egg is fertilized and is only raised during pregnancy. There was no increase in the HCG in women with an IUD, but there was an expected increase in HCG in the women who became pregnant. There were also other studies that looked at the characteristics of the eggs a few days after ovulation, and it was clear that the eggs had never been fertilized in those women with an IUD in place. From the standpoint of effectiveness, ease of use, cost, and safety, IUDs are a great contraceptive choice. If you are interested in talking about which type of IUD is best for you, make an appointment to discuss this and get the process started.